How's it going, guys? We have a difficult question for neurology step 1 pediatrics 2CK. 4-year-old boy, he's got a 2-month history, abnormal eye, bodily movements reported by his mother, no past medical history. Physical exam shows slight violation appearance of the eyelids, rapid involuntary movements of both eyes. There are sudden, brief muscle jerks of the left arm and right leg. Midline abdominal mass is palpated. Blood pressure elevated. The EEG shows no abnormalities. Question wants to know the most likely diagnosis. Now, when I just ask you a diagnosis straight up, tends to be a more difficult question, okay? Because if it's a very pass level vignette, I'll ask you something more tricky regarding the answer choices. So let's just hop through. Choice A, dermatomyositis, wrong fucking answer. We have violaceous appearance of the eyelids. You could argue that's heliotrope rash. And on the pediatrics forms for 2CK, there in fact is a dermatomyositis question, I believe, in an 8-year-old. And students are like, oh, I thought that had to be adults. I agree with you, but there are diagnoses that show up in peds that can be typically adults, okay? Dermatomyositis is one of them. It's not the answer here, okay? But dermatomyositis would be just polymyositis with skin findings. Polymyositis being proximal muscle weakness on physical exam, increased creatine kinase. You must have one of those two, and you can have CD8 plus infiltrate of the endomysium surrounding the muscle fibers. You can have the skin findings being your Gaucher papules, can be violaceous eyelids known as heliotrope rash, can be mechanics hands, shawl rash. Dermatomyositis, increased risk of non-Hodgkin lymphoma. Wrong fucking answer. Choice B, and you should just know anti-Jo1 Mi2 antibodies for dermatomyositis. Choice B, lupus. Wrong fucking answer. This can absolutely be pediatrics as well. Okay, I've made clips on this, but not the right answer here. Okay, so vignettes for lupus will give you arthritis 100% of the time. It's the most common finding in lupus. And then I'd say the second highest yield finding, apart from the classic malar rash. Don't confuse the heliotrope appearing rash of dermatomyositis with the malar rash of lupus. So they'll give you a 30-year-old woman who has arthritis, just generalized arthritis, and a malar rash. They can give you thrombocytopenia. Okay, so apart from that rash, thrombocytopenia is the highest yield finding in lupus. So 35-year-old woman, arthritis, thrombocytopenia, no mention of malar rash, no other information. That's lupus till proven otherwise. Okay, so obviously double-stranded, anti-double-stranded DNA, antibodies, anti-Smith antibodies. Wrong fucking answer. Choice C. Real quick, actually, pediatrics form that mentions lupus. They want lupus cerebritis. They'll give you a seizure in a kid, okay? Just inflammation of the cerebrum, literally. Okay, you can also get myelitis, Brown's acquired syndrome. As I already said, wrong fucking answer. Choice C, neuroblastoma, correct answer. It's a pediatric version of a pheochromocytoma, basically. That's an easy way to remember it, okay? So they'll give you a midline abdominal mass in a kid over the age of 2 years. And this is really important because if you have a flank mass, let's say in a kid over 2 years, that's Wilms tumor, nephroblastoma. I've seen kids choose Wilms tumor for this. I'm like, is your kidney in the fucking midline? No, clearly not nephroblastoma, Wilms tumor. And the other thing is, if you had, let's say, a 12-hour-old male who has a midline mass, clearly that's not going to be neuroblastoma, too young. That would be posterior urethral valves where you have a full bladder. Okay, so a young kid with a midline abdominal mass, classic for neuroblastoma, it's a tumor of the median, the midline, the median sympathetic chain, classically abdominal. It can occur in the posterior mediastinum, and that shows up on one of the pediatrics forms. Okay, so neuroblastoma, you can get what's referred to as opsoclonus myoclonus syndrome. So opsoclonus myoclonus syndrome, opsoclonus is dancing eyes. Okay, that's what we have here. And then myoclonus is rapid jerks. So just classic finding in neuroblastoma, you get hypertension. Okay, so you have catecholamine secretion by the tumor. As I said, it's a pediatric version of pheo. And one of the highest yield points is they can give you the violaceous eyelids, which are metastases to the eyes, causing raccoon eyes. Okay, it's It's supposedly not a common finding, but it shows up on one of the PEDS forms. And another point you need to know is that you diagnose with the first test you do for USMLE is urinary homovanillic acid and vanillyl mandelic acid, urinary HVA and VMA. Don't choose urinary metanephrines. That's pheochromocytoma instead. Okay, so it's N-Mike gene for neuroblastoma. Let's just whip through the others. Pheo, wrong fucking answer, as I just said. This is going to be adults. This is going to be adrenal medullary tumor secreting catecholamines, and you're going to do urinary metanephrines for this. And it can be idiopathic on its own. It can be part of MEN2, so MEN2A or MEN2B, and you're going to give phenoxybenzamine alpha 1 blocker to treat. Wrong fucking answer. Try to see West syndrome, infantile spasms, wrong fucking answer. When students don't know a diagnosis, they tend to choose weird sounding shit. This does show up on 2CK and step 3 PEDS. It's not step 1 level, but West syndrome is going to be a seizure disorder. It's actually X-linked recessive that will start as young as 2 to 4-ish months of age. So infantile spasms, myoclonic seizures, 2 to 4 months old, just a kid under the age of 1 classically, and it will lead to ultimately neurodegenerative disease with regression in behavior. And this can be associated with hypsarrhythmia, which is a chaotic EEG pattern, a nonsensical EEG pattern where we said here the EEG shows no abnormalities. West syndrome, wrong fucking answer. You know the deal. I'm going to make more content. I feel like my stuff's screaming. Appreciate your time. That's it.